functional medicine doctor practicing in New Orleans, Louisiana, and I'm super excited to have a patient of mine by the name of Noah here to share his experience with Lyme disease recently. Hey, Noah.
Hey guys. Hey doctor.
Hey, man, Noah, thank you so much for coming and sharing your story. The reason I was so excited to have you come on and talk is that I see a lot of patients who think they have Lyme disease and they don't, right? So I know we've joked about this in the clinic before, but I've probably seen 40 or 50 patients who have come to my office after having spent thousands of dollars, years of their life chasing tick-borne infections, hidden infections. They've done ozone treatments, they've tried stem cell, they've had years and years of antibiotics, and I've just seen so many patients who haven't gotten well doing that. And so my bias is to think that something is not Lyme disease. If someone comes in, it's usually not Lyme disease. It's not a hidden infection. And part of that might just be because I practice in New Orleans and I've got a very different patient population than if I was in Virginia or Maryland, right? In parts of the country where Lyme is really common. But it just doesn't so happen that many cases of Lyme come across my door, and until you recently showed up. Will you start by sharing what happened when you got ill?
Sure. Um, Absolutely. So that does not surprise me, that you don't see many patients that actually have Lyme. I mean, my case is a little bit unique in the fact that I grew up in New England. I go back every summer to visit, which I had done last year. And me and a friend went hiking in Vermont and kind of went off trail a little bit. We're very deep in the woods and just had a whole day adventuring outside and deep in the brush in Vermont. But I live in New Orleans and I've lived here for years now. So I came back home, and it wasn't until 2 or 3 days later when I found a tick.
Yes.
It's still engorged in me, which is important. I knew that the duration of time that the tick is on you matters.
It does,
And
yeah.
having grown up in that area, I knew that there was risk definitely for Lyme. So it was something that I was monitoring, and was on my mind right away. Unfortunately, I did not really do the things that I probably should have right away. I was lucky to have found the tick within the first couple days. Um, I never got a bullseye rash,
Right.
which lots of people probably assume is like goes hand in hand. But I knew that the
The
tick
bullseye
being
rash
in.
is in a minority of cases.
Oh
More
really?
people than
I
not
Yeah,
will not have the rash.
interesting. So I didn't even know that. I thought it was still at least the majority, but I knew it wasn't every time. So right, so that happened. I got some bad advice, which was to wait, and this wasn't through you. This was like through like a family friend or something like that that claimed to know what to do.
Yeah.
To wait because the blood work would be inconclusive for a couple months. So just wait for a couple months to see whether or not you even have it or not, because it's not a guarantee that you do. So in the meantime, the bite took place in about August, late August. Um, I started to feel progressively worse after a few weeks, to a month
And
and a half. But
share some of the symptoms
yeah,
that really got you down in that fall. Because you
so
were a healthy guy. I mean, you're healthy now,
yeah,
but
yeah,
you were really struggling, way out of character. What did it feel like?
absolutely. So the first and foremost thing that I've been struggling with was like a massive amount of fatigue,
Right.
um, which is tricky because it's difficult. Like it could have been a number of things, but
Hmm.
this was not. This is not normal. Like I'm healthy. I exercise. I eat well. I don't really have any bad habits that would lead to me being as tired as I was. I was sleeping 12, 14 hours a night, um, and really needing a nap in the
Yeah. And you're
afternoon.
24, right? You
Yeah,
couldn't
yeah,
need that much
yeah,
sleep. Yeah.
24 years old. Like,
Yeah.
and even when I was sleeping all that time, I just was tired when I was awake and was like kind of cranky and just like I did not have the energy to do the things that I normally do, and that obviously had a psychological impact on me. It was making me
Hmm.
depressed, whatnot, and I was also having this joint pain in my knees,
Yeah, I remember the
and
knee pain that didn't make much sense.
which is
Yeah.
not normal for me. Usually have like a little lower back pain. I mean, I'm a bartender, so I get a little bit of back pain. I'm on my feet all the time, but this weird knee pain, this neck pain, stuff that I
I remember
never
you were
experienced before.
generally achy, and I think you
Yes,
struggled for a little while until you got your hands on the medication doxycycline. And
yes,
what happened when you took that course of doxycycline?
right. So initially, I uh, I got started on the doxycycline. Within I want you'll have it in the notes better exactly how long, but I think it was within days to a week.
Yeah, you told me within
I
3 days you felt
Yeah.
your energy was better, your
Hmm.
achiness was about 60% down, and I think you took it for 2 weeks.
Yes.
And a week after you finished the antibiotics, it all started coming back.
Yeah. So I knew it. Basically, everything was confirmed when I started taking that. I was like, okay, this is clearly what I should be doing. This is like noticeably how like I was lucky
Yeah.
in that the treatment that I did was like absolutely like cut and dry. I was like, okay,
Well,
this is definitely
here's the
making me feel
first,
better.
yeah, this is
Yeah.
the first important point that I want someone, if they're thinking if they have Lyme or not, they should get a dramatic improvement when you treat with doxycycline, right? If you're
Hmm.
think that you have a chronic infection and you're using the right treatment, but you're not responding, then I
Hmm.
think it really raises the possibility that you've been misdiagnosed. But you obviously did quite well with doxycycline. And the other point that's important is that a lot of the traditional recommendations are like, oh, take like a short course, take a small course, take a week, and you should be good. And you took 2 weeks, right? So you went
Yeah.
a little bit above what most patients get, but that still
Right.
wasn't enough, right?
Yep. That was not enough. And then after that, I think it was even maybe a month back on again, improvement afterwards. And stopped in after stopping was within 48 hours, I think I was uh, immediate same fatigue symptoms
Yep.
that I
Yep.
had been like right off the bat, almost like feverish in a way. Like
Which
the
is
aches
just
felt
classic
like,
for your body saying that you need more treatment. I
yeah,
think that's
and I
about
felt
when you found
horrible.
me. Is that about right? The timeline?
Yes, yeah, yeah, yeah.
And then
Um,
what did we do? What did we do right off the bat? I mean, I have it here, but I'd love to hear it from you.
yes, so we got on the doxycycline, and I was also taking an azithromycin
Yep.
nightly. A very extensive probiotic regimen, which I would also completely recommend for anybody taking these antibiotics because
You
I
have
was
to.
worried. I was going into this not really knowing much, and I knew that antibiotics would be bad for my gut health, and I had already been having a little bit of like gut problems anyway, so I was worried about that. The probiotics made a huge difference. Like, definitely kept me feeling very normal gut
Yeah.
wise and okay there. Um, and oh,
So we ended up giving you I ended up pre-treating you with aggressive probiotics, and if you're a patient of mine, that's not a
right,
surprise. I am a huge proponent of often high dose broad spectrum probiotics, and that really helped smooth things along, and I think prevent problems because the moral of the story here is that you ended up needing a fairly prolonged course of treatment to get all the way better. And
right. So,
initially, we gave two antibiotics, right? Azithromycin and doxy, and that was a little bit too much, wasn't it? So what did we have to do?
oh, right, yeah. So I was fortunate in that I tolerated the doxy well. The azithromycin was putting my stomach through fits, and it was like cramps and like it was very uncomfortable. I would take it at night. I would wake up in the morning in a bad way. Um, so
So we had to make a dose adjustment, right?
yeah,
We had
we
to
cut it
really
in
slow
half,
it
I believe.
down.
Yep.
We
And
did,
that
and
helped
it's
for
really
sure.
important when treating these infections to not just say this is the dose that I
Mhm.
read that you should need. It's so important to modulate based on your symptoms, right? So
Right. Yeah.
even though my mentor, because I don't treat tick-borne illnesses that often, I reached out to my mentor and got some advice, and he really suggested that higher dose. But Noah, it rocked you. You felt worse,
Yes.
so we were going
Yeah. I
too
mean,
quick, right?
it was a lot. And yeah, and you can read about it, especially with Lyme too. I would say like you read all these things online, right? But it's definitely important to stick with the dose that like which
Personalized.
you yeah, right. And which was I was fortunate to have you to help me walk through, and I could kind of report back these symptoms and then say, you know what, clearly like this is like, you know, the goal is to make you feel better. You're waking up and feeling bad off of this. Like,
And
let's
it's
cut it in half. That dose ended up being great for me, and my body got totally used to it, which was another fortunate thing.
And as
Um,
long as you were on the antibiotics, symptoms were really gone almost completely. So
right.
we
Yep.
treated for another, I believe, month or two with kind of combination antibiotics. But when we stopped
Yes.
the antibiotics again,
Yep.
symptoms came back, right?
Yep. That's the
And
same. Yeah. Yeah. Yeah.
this is where I was really, really just so happy to be working with you because you brought to me some really great research on some herbs that I didn't have as much familiarity with. And
Hmm.
we ended up pulsing in those herbs to the antibiotics. And I think that was really, really a game changer and really
Hmm.
helped speed this along. To tell us a little bit about the herbs, if you recall, I can if you want to share how you came about finding those and what we did.
Sure. So, after the second course of antibiotics, it was about a month back on and feeling worse again. At that time, I was starting to become a little bit disheartened. I knew what we were doing was working, but I was very concerned that like this might be now a much longer process than what I originally was expecting.
Hmm.
So I did what could be good or bad, but I went online. I went into some forums of people that have Lyme, and almost everybody was swearing by a few herbs in specific. The first being Japanese knotweed,
Yep.
and along with cat's claw vine, and I believe the other was a
Andrographis was the third.
andrographis and
Yeah.
cryptolepsis as well. So
Yeah.
there's a bunch um, that
Yeah.
it
In this case, the internet gets the win, right? This
yeah, right.
because pulsing these in really made a difference.
Right. So what I figured was, I probably tend to lean more towards like a holistic approach of treating illness in my life anyway, but I recognize the importance of the antibiotic, but I figure adding these on top is not going to really do anything negative. Like it had mostly upside for me, other than of course like the money, but there is ways to do it relatively affordable, and like I just wanted to feel better, so it didn't even matter. Um, so yes, so then I started on these herbs, taking tinctures of them. I think you would have the specifics of
Yeah,
uh,
we don't need to
yeah, right,
dosing. We can talk about with
right,
individual patients, right?
yep. So then I started taking these herbs daily, about 3 times a day,
Hmm.
along with some adrenal support herbs as well,
And
like
continuing the antibiotics,
and
right?
continue never changing the antibiotics
Yep.
the entire time, because the antibiotics at this point, after stopping the second time, I was nervous. I was like, okay, this is going to be a long game with the antibiotics. I'm not going to stop again for, I think we did 6 months
We
was
did
our next.
six
Yeah.
months, and at the beginning of your case, particularly given how well you responded to antibiotics, I thought it was going to be a 2 to 3 month course on
Hmm.
on antibiotics, and I think I told you as much. And so,
Yep.
but the moral of the story is we listened to your body, and we just went longer. We went 6 months total, but
Which, yeah,
uh,
it could have potentially been 2 or 3 months, but I think we just, played it safe, did the six. I would say the antibiotics had me around like an 80%. I felt good. I was working. I
yep,
was the joint pain and brain fog were pretty much subsided. It was just still like residual fatigue, and like I
Yeah,
didn't
but
quite
and
feel
again,
right. Like,
you were 24, so the 80%
yeah,
is not good enough. Like we should be
no, it
able to
was like
clear this. And
exercise would still kind of knock me out a little bit, and I
yeah,
couldn't really like work out or do the things that I wanted to. And so the extended time on the antibiotics, as well as
the
adding the
herbs.
herbs on top after about another, the herbs took a little bit longer for me to notice. Honestly, I would
I
say
think at
probably
that
3 weeks to a month
for
maybe before
most
I.
for most of these infections, you're going to get most of the gain initially, and
Mm,
then it's going to be a very slow and steady progress up. And so it's hard. You may not notice the shifts because it's so slow, week by week, week by week. But eventually you get to the point where you're saying, oh, everything's gone. I'm back to normal. And so from November to mid-May, that's where you had gotten. And it was really fascinating to learn about those herbs and see them work in. And another moral of the story is of course, a few weeks after you, I had someone else come in with a different type of infection, but I ended up using herbs and doxycycline too aggressively at the beginning. So,
mm,
in retrospect, I think you were trying to say maybe we should have added the herbs in before, and it's possible maybe we should have, but sometimes going too fast slows things down.
mm,
So the gentleman that I'm seeing working with now has a reactive arthritis from an infection called mycoplasma, right? And the same combination of doxy and herbs really hammered him too hard at the beginning. So now we are slowing down, building up more support, and then we're going to add in the treatment
mm.
slowly. So I think that there's still a little bit of a lot of listening to do in
Right,
medicine,
right.
right? And
Yep.
everyone's got to have a little bit different perspective. Any other big picture thoughts or reflections on being ill with Lyme and now having it in the rear view mirror?
Right. So now I'm feeling great, honestly. So
Yeah.
that so I don't even know if I got there yet, but after the 6 months of the doxy and the azithromycin and then the herbs, I'm feeling back to normal. Fantastic. I'm just so grateful um, that I was able to uh, find the right people and learn the right things and everything to feel better. So I just felt it would be a good opportunity, and thank you for giving me this opportunity to talk about it, because a lot of people that do get sick with Lyme are they don't really know what to do. There's so many different conflicting things on the internet, and I've talked
It's
to people in
really in
person
line.
too
Yeah,
who think people think that they sound crazy when they talk about their symptoms, because a lot of people don't understand like just how bad that this can be, and I just want people to know that you're not crazy. Like, these things can happen and it can be intense, and there's nuance to all these situations, but hopefully my experience in my recovery journey can maybe shed some light for people
it,
to
I, I
try to
know
get
it's
their
going to
best
help. I
recovery.
know it's going to help both people who think they may have some vague symptoms but think they have Lyme. I think they'll hear your symptoms and say, you know what, maybe Lyme isn't it, and we can save some people from going down the hyper aggressive, really extensive over treatment of Lyme that I see.
Right.
But on the other hand, when people really do have Lyme, they get to hear a story of hope that it's not
Mm.
that hard. You go low and slow. It takes longer than I want. I know it took longer than you
Yeah,
wanted.
but it could have been so much worse.
It could
And
have
some
been
people say
years
that
of
you can't
misdiagnosis.
feel
Yeah.
better. Like, there's stuff online of people saying you'll have this for life. Like, just get used to it. Like, this is no. Do not accept that first and foremost. Otherwise, that's going to be a whole other process that you're going to have to deal with. Yeah, low and slow. Getting people. A very important thing for me is, I would say, I wish going back that I had just immediately taken doxycycline immediately after finding the tick submerged for 48, because then maybe a 2 week cycle of doxy in the very, very, very early stages could have been so much help, so much more helpful. you know.
I think that's the right
Um,
move. Yep.
so the doxy is so important. Like, please, like,
Don't be afraid of
some
antibiotics.
people have an
Patients, yeah.
aversion to antibiotics. Do
Hmm.
not do like it, these medicines work. Like, they're not ideal for your gut health or whatnot. But we're fixing that now with the probiotic. You know what I mean? It's like that's
Exactly.
the least
There
of
are
my
fixes.
concerns
Yeah.
when I'm feeling absolutely horrible, can't get out of bed. Like, and then this is making me feel better. It's like, yeah, like this is killing the bacteria that are making me
Yeah.
feel ill. You know, so
It's
that's important.
the beauty of integrative medicine is when we can use tools from both sides, right? We can use the antibiotics appropriately, we can
Hmm.
mitigate the side effects, and then we can also pulse in the natural treatments, the andrographis, the knotweed, right? That I think really made a big difference for you. So it was
Yeah.
just a fun case. I'm just so grateful for you sharing this. I know it's going to help people. And any last words you'd like to share with people?
No, I think
You
I
nailed
think
it.
I've, yeah, I think, yeah. Just thank you to you for helping me through this process, and I'm excited to be able to share
Hey
as
man,
well.
well I
So
got the privilege of being able to learn about some herbs I don't commonly use for Lyme, so that's great. Yeah,
cool.
it's a win-win,
Yeah,
right?
yeah. Awesome.
Yeah, we did it together. All right, buddy. I'll see you next time. Let me know if you need something, okay?
Sounds good. Thanks, Doc.
All right.